Good morning. My name is Michelle Ward, and I'm with the Texas A&M College of Veterinary Medicine and Biomedical Sciences. And you are watching the Large Animal Veterinary Technicians video conference, Our Patients Whinny, Squeal, and Moo. Today our presenters are going to be Ms. Sheila Gibler and Ms. Sandra Nunn. And I'd like to tell you that this is brought to you by the PURE program and funded by the Science Education Partnership Award and the Emma Barnsley Foundation. So now I'd like to introduce you to our veterinary technicians, Ms. Sheila Gibler and Ms. Sandra Nunn.
Good morning.
How's everybody doing today?
I can't talk to
I know.
So, yeah. We'll have to get used to that. Sorry, we're used to a live crowd. All right, this morning we're going to talk to y'all. We have a little PowerPoint presented for you. We brought some kind of visuals to go over, and then at the end we'll allow y'all to ask us some questions. Okay, so my name is Sandra Nunn. I am the Large Animal Medicine Technical Supervisor at Texas A&M Large Animal Hospital. I'm also a past president of the American Association of Equine Veterinary Technicians and a founding member. I'm also on the Texas Association of Registered Veterinary Technicians Board as the associate rep. Sheila, would you like to introduce yourself?
Sure. I'm Sheila Gibler. I am a registered veterinary technician. I work here at the Large Animal Hospital, also with Sandy, and I work in the food animal service, which food animals are pretty much anything, any animal you would put on your table for dinner. Plus we have a couple of extras in there, which would be llamas, alpacas, and deer that we use to farm raise. I guess some of you would eat them for dinner, however I don't.
All right. Okay. So what is a veterinary technician? So, veterinary technicians work under a licensed veterinarian. Technicians do not diagnose. They do the prescribed treatments, but they're kind of like a nurse to a doctor, but so the animal version of that. There are many different levels. Like I said, I am not a credentialed technician. I would be more considered, I guess, a veterinary assistant. However, my years of experience have raised my level of what the doctors allow me to do. So there are your on-the-job trained staff. There are your certified veterinary assistants. They have that level. And then there are registered veterinary technicians here in the state of Texas. We are doing some legislation to change that to possibly a licensed veterinary technician. With that, there's a 2-year AVMA approved school before you can sit for the state and the national boards. And it doesn't necessarily transfer to state to state, so you have to check on that if you decide to move. For as far as what Sheila and I and where our interest lies, obviously I have a preference for the equines, so horses, donkeys, and mules. I actually grew up showing donkeys and mules. They're near and dear to my heart. Sheila just went over that food animal includes the cattle, sheep, goats, and swine, and in our particular clinic, also the camelids. As far as the duties go, it really depends on the given day. Every day is different and unique. I think that's part of the beauty of it. But obviously some of the routine things we do with the managing of the herds, whether that be food animal or equine, are vaccinations, dentistry, or anything oral, especially in cows. If they can't eat, they're not going to gain weight. Dehorning, field service farm calls, reproductive health of the breeding stock, right? That's kind of the business aspect of it. That can include artificial insemination, embryo transfer. Okay, we kind of already went past that. But so there are exams, and again, it varies from state to state. So just because you become registered in the state of Texas does not mean you can move next door to Louisiana and set up practice without. You have to check with their state association. But there are optional specialty certifications. that you can go to beyond the 2-year degree. The AEVT just recently was approved for one in equine veterinary nursing, so that is a specialty you can pursue. Sheila?
There's quite a few in the small animal world. We have, I do both small and large animal. Right now I'm primarily large animal. But you can get a specialty in anesthesia, in dentistry, in oncology, so the chemotherapeutic cancer patients. There's also emergency and critical care specialists. And I believe they're also starting to do specialties in cardiac care. So all those patients that have heart issues, you can also specialize in that.
Yeah. Nutrition?
There's a nutrition, and I believe they're also working on one in internal medicine. In internal medicine, you think about it, kind of encompasses all those other groups. So your cardiac is internal medicine somewhat. So the internal medicine specialty would deal with heart, lungs, livers, kidney, that type of thing. Everything that makes sure that you're a healthy being.
And they're starting work on a surgery one. So,
I didn't know that. So that's another fun one to get
so it's
involved
constantly evolving. So, you know, you can always pursue those to further specialize in your career and hopefully with the goal of making more money in that career.
One of the things that veterinary technicians have to do also, we were talking about the specialties, we are required to have a certain amount of continuing education hours each year. So just because we've gone through the schooling and now we have our certification and we work every day doesn't mean that we ever stop learning. We have to continue to learn new skills, new information. A lot of times, especially here at the university, we are on the cutting edge of research also because both Sandy and I have to assist in the research of the animals and the different techniques that they're developing for the animals and for the care of the animals here.
Right. And so the hour of CE that they have to get per year in the state of Texas is 10 hours per year. All right. Experience, obviously, the more experienced you are in a given job, the more valuable you're going to be. You know, right now I am hiring for a lameness technician, and so I'm looking for those people that actually have worked with horses, that have the experience with lameness exams, have the restraint skills, have those things that I need them to do for that job. So, you know, any amount of experience, if that's the way you want to go as far as a career, start thinking about it now. You know, if you truly want to be a veterinary technician or a veterinarian, then you need to be out there volunteering for your local vets, your local animal shelters, you know, whatever you can do to show that you are investing your time in your career. And if that's large animal, then, you know, there's also 4-H, FFA. With a 2-year degree, you can imagine the majority of the time spent there is going to be on small animal. And because it is more costly to house large animals, so most of your vet tech schools aren't as fortunate as our local blend program that we have a partnership with, so they come over and use all of our equines, all of our cattle, our pigs, what have you. But so you need to get that experience on your own. You need to take an active role in doing FFA, 4-H, working at the local vet clinics, whatever you can do, showing your horses, showing your food animals, something to get that experience.
Those of you that don't necessarily live where there's a lot of livestock, look into farms outside your town. I did not grow up dealing with livestock. In fact, the closest I ever got to livestock was what was on the table for dinner. So I learned everything later when I was in college, that type of thing. I made it a point, because I loved working with large animals, to go out and call the local farmers. I saw a big cattle ranch, just stop by and ask the guys out in the field, is there any way I can come out and learn how to handle cattle? Cattle, they're a totally unique being. They're not like horses that you can just walk up to and say hi. Most of them, when they, I think, you know, if you drive by the field and see the cows, you stop and talk to them. They think you're an alien from another planet. They don't think like horses do. So you have to be able to learn that and find the time.
All right. So as far as the chosen career field, as far as large animal go, and a lot of these apply whether you're large or small, everybody, of course, recognizes that we work in veterinary hospitals. So your private practice clinic is the first thing that people think about as far as a career. Some other career areas available to large animal veterinary technicians would be the zoos, right? They've all got hoof stock, they've got ruminants, so they need help there. Research settings, you know, these, just like in people, those medications don't come around on their own. It takes that research aspect to look into the different drugs, different treatments, and there's always roles for and jobs for veterinary technicians there. Okay. All right, there's educational settings. You know, that's where Sheila and I work, and I certainly find helping educate veterinary students with their technical skills a very rewarding goal. Not to mention it has, for working for the state, some great health perks. Disaster and emergency response, there's a lot more talk about this nowadays. And so, you know, even if you're working at your private practice, there are groups that, through the USDA, that you can apply for, and there's different county-wide groups, statewide groups that you can choose to volunteer, some paid, that you can work at. Food safety, again, more Sheila's area, because it is the food animal, but you know, we have those regulations in horses too, although we may be a little squeamish about it. Here in the U.S. we don't eat horses, but there are many places in the world that do, and so a lot of our drug laws are all go by what would happen if that animal were eaten and what are the withdrawal times. But so there are places in government work and food safety for veterinary technicians as well. And then again, with the reproduction aspect, commercial breeding, you know, there is the business aspect of all of the livestock. So,
just because there's a horse picture up there, there's commercial breeding in cattle,
yes,
goats, sheep, swine, and all those are options for veterinary technicians to work there with them and help produce quality livestock.
yes, and that's actually a more steady job, probably.
Very true.
As we've learned recently with the decline in horse racing, also the decline in equine prices. So now we're going to kind of talk about a little bit of what Sheila and I, or any large animal technician may encounter on a daily basis, which again, it's ever evolving. So, you know, there's always those mundane things, and I know I've done most of the talking, so jump in there anytime. I have a big mouth, so it just keeps running. But certainly for either, whether it's food animal or equine, morning treatments, you know, every day those patients need treatments just like a human would in a hospital. There's updating the charges. Oftentimes it's the veterinary technicians that put in the charges for all of those treatments, medications, procedures that are done in the hospitals, and scheduling appointments. So you have to multitask a lot.
We don't necessarily always get the fun part of the job, which is dealing with the animals. We also have to be office staff, which when it comes to updating the charges, that includes keeping the medical records up to date. So you have to be computer literate. You have to be able to write well. You have to be able to understand the financial aspect of the veterinary hospital as well as the medical side of the veterinary hospital, because it doesn't matter how much you love that patient, if you don't make some type of money off of it, you're not going to be able to survive. And this is private practice as well as in the university setting that we are. So, you know, we all love dealing with the animals, but we all have to deal with the business side of it also on a daily basis.
Right. Good point. So as far as the equine side of it, you know, they bring an animal in and we're going to do an exam of some type, right? They didn't bring it in because it's doing okay. There's obviously either some type of health routine work that needs to be done, or there's a problem with it. That could be in the areas of lameness. That could be a physical exam. That could be reproductive exams, ophthalmic exams, right? You know, both horses and cattle often come in with eye problems. There are dental exams, right? They need routine work. Then we have vaccinations. They need shots just like we do. Coggins test, right? So there are certain procedures if you want to travel with animals, whether it's food animals or whether it's horses, that we have to regulate for disease purposes, right? We want to control the spread, so we test for Coggins on horses. We do brucellosis testing on cattle.
And you have to remember, every state has different regulations as to what they require when livestock crosses their borders. And there's federal regulations as well as state regulations. So your state may not necessarily require a Coggins test across the state line, but federal regulations will. And brucellosis testing, Texas is considered a brucellosis-free state, as well are quite a few of the others that join Texas, but other states can't claim that. So you have to meet those certain requirements, and the only way you're going to get those papers to where you can cross the border is to go to your veterinarian. There's stations along the interstate as you cross the borders that will stop the vehicle, look at all the animals, check the paperwork, and if the paperwork's not accurate, they can take those animals and hold them until you can get the proper documentation. So we think not only statewide, but we also think nationally when it comes to health certificates and that type of thing.
To think about if you're going to choose a career, because so those clients bring it in. They haven't necessarily read all the rules and regulations. So it is a lot of times the technicians that will get on the internet or get on the phone and look up what those state regulations are. So, we sure? I don't have the comments. I mean, yeah, sure. All right. So we're going to take an opportunity and show y'all some of the things that we brought today just for y'all's. So for dentals, yeah.
How would you like your teeth fixed by your dentist with this? A little bit bigger than the normal drill.
Right. But it's got, there's a little plate with a grinder. So horses, their teeth grow continually all their life. So sometimes one tooth with the wear and tear on it may get a little crooked. It may develop some sharp points. It may develop what we call a wave mouth. And so we actually go through and use this grinder to smooth it off so that they can chew their grass, chew their grain. And so that, we're brave, but we're not stupid. We also have tools to help us manage to hold open the mouth of the horse. So we sedate them, and we use it in cattle too sometimes if we have to work on them. Right. Put the mouth speculum in and pry it open so that we can actually stick our hand in there and feel around.
And here's the picture of that.
The slide that you're looking at is pictures of a student actually, we call it floating their teeth on the horses. And you can see the mouth speculum is in there. And then she's got the drill in the mouth and she's taking those sharp points off the horse's teeth. It's kind of heavy.
It is kind of heavy. And so, yeah. But does that mean that if you're a petite person in stature that you can't do large animals as a living? Obviously not.
No.
Sheila's pretty petite. Yet, it's not the size of the dog in the fight, it's the size of the fight in the dog, is what I like to tell the students. But it's also working smarter. Obviously, we've got tools to make a more level playing field for us. Some of the other types of exams that we do with horses, especially, I don't know if any of y'all have heard of West Nile. It's a neurologic condition, so we have to do neuro exams on horses. And so again, you can see the technician in this picture, Carlotta. You can go ahead and show it, yeah. is rather a petite person too, but she knows her way around a horse, and so you know, she keeps herself safe and all of the students and the doctors and the clients at all times. But so this particular one has a cervical instability, so his cervical vertebrae, when he bends his neck, decreases the fluid and the nerve pathways there, and so you can see every time he bends down to go eat, then he has problems standing up. But so we often do neuro exams and have to walk them and do different proprioceptive testing, or to look for proprioceptive deficits, any instabilities.
One of the nice new things that we can do, she was showing you the video of the neurologic course, we now have the capabilities to do MRIs, so magnetic resonance imaging, and CTs, which are CAT scans, of these horses, of their necks, of their head, of their feet. Things that we used to not be able to do, because if you think about it, this is a
Yeah, we've got it.
1,200-pound horse that you
The
have to then
ultrasound.
lay down and put into a small tube to take those pictures. So it's a much better way of being able to image those fine motor places such as the muscles, the vertebral discs, the nerves, and that type of thing. So one of the things that veterinary medicine is moving forward in is the diagnostic imaging of large animals. We can do it with horse, cattle, sheep and goats are much smaller because they're about the size of a dog, so we've been able to do that on them. So you think about, you know, granted the lameness exam and the neurologic exam on that horse was able to figure out where the problem was, but an MRI would show them exactly where that problem lies in the neck.
Right. So some of the other things as far as diagnostics, right, we've talked about kind of our exams and trying to figure out where the problem is. We can further clarify that by diagnostics like the MRI and CT, like Sheila was talking about. Radiographs and ultrasound, just like your doctor may use on you, we also use in all the species. Blood work, endoscopy. So what is endoscopy? Endoscopy, if you have stomach or GI problems, then your doctor is going to use a camera and he's going to look at your stomach. We have that same capability with the cattle and the horses. Of course, the scope that your doctor probably uses is not quite as long as the one we use for GI. It's 3 meters long.
So when she says it's 3 meters long, think about that. 3 meters is about 11 feet.
Yeah.
So we have this little fiber optic tube, and it's not like when you go to your doctor and your doctor says, can you open your mouth, I'm going to slide this tube down your throat. Generally when we ask a horse or a cow or a goat, you know, do you mind if I stick this 11-foot long tube up your nose and down into your stomach, they don't necessarily appreciate it. But they do cooperate, and we get some beautiful pictures, and that way we can diagnose, well, this horse is not eating well. It's not because of his teeth. It's because he has ulcers in his stomach, because they get ulcers just like we do. We all have the same problems with our GI tract when it comes to the horses and that type of thing. And so we can diagnose much easier, and we use the same medications. You know, Prilosec in people, we use it in large animals too.
In greater quantities.
In larger quantities,
Yeah.
much larger.
And that limits us sometimes, you know. With us, we have insurance, so, you know, your parents don't necessarily have to pay for all the medication in full. They kind of pay as they go. But unfortunately, with some of the livestock, we have to, it kind of limits the drugs we can use because of the cost to the owners. Okay, yeah. We're going to go back to our PowerPoint right now. As far as the endoscopic exam, we've got one of the 1 meter scopes that we're going to actually show y'all, where we're actually looking at the upper airway of a horse. So in the upper airway, there are multiple places that a horse can have problems. We're going to pass it up through the nose, and we're going to look at the back of the throat. We can visualize within the guttural pouch. We can see the bones of the ear. You'll see it wiggle as the video shows. And we're going to look at for things like if it's a roarer, if its flaps in the back of its mouth aren't opening every time it tries to inhale air, then it can't really get a big air, which is really important for performance horses, barrel horses, racing horses, right? In order to run fast, you need that wind. So if there's anything occluding that, then we have surgeries we can do for that. We're also looking for infection. Oftentimes the horses have infections in their guttural pouch. So we will actually pass a little tube into the scope, pass it into the guttural pouch, and then follow that with the tube. So y'all be able to see that. And here's a picture of someone actually doing the exam. This is a private practice, so they're actually looking in. The ones up here at the school, if we had this scope, we wouldn't have this video. But we have, we are very fortunate to have all of the cool toys. And so that's a little picture in the guttural pouch, which you'll see in the video. And that is something we don't want to see in the guttural pouch, a fungal infection. All right. All right. So here you can see all the nose hair. We're passing up the nose of the horse. And so most of the time we don't sedate the horses for this procedure, but we do usually put a twitch on them. Again, like Sheila said, they don't usually volunteer to have this procedure done. So we're going to pass it up the nasal tubes until we get to the mouth. And there at the mouth you can see the flaps on either side, which are our guttural pouches. You see the soft palate, which is the flap on the bottom coming up. And so the tube being passed right now is going into the guttural pouch. And so you've got to, it's definitely a learned skill. You've got to get it at the top of the guttural pouch before you can get the tube in. There you go. And so then when we get in the guttural pouches, obviously we're going to look on either side of that stylohyoid bone in the middle, which is always our main reference we point out.
Oh, sorry.
Oops. Maybe
Sorry about that.
Slide it forward.
Yeah. There you go. Sorry.
There you go.
I thought I could point to
And
it.
so
with
we
the-
can look here in just a little bit on this one. They're going to wiggle the ear right there. You can see the ear bone. And so we can check for all of the nerves and the bony function there. Sometimes you get fractures of the stylohyoid bone high, and that'll cause them to appear neurologic because they'll be holding their head. It also can keep them from eating because every time you chew, it's like your TMJ joint in the back of your hinge of your jaw. Every time you chew, it bends those bones and it hurts. So if you have problems here, it can keep the horse from eating. So we'll often look at it if they're having weight loss as well as look at the stomach. They're going to go into the other side of the guttural pouch right now. So we have to check both sides. And this one's going to come up normal as well. But then in the back of the throat, over the soft palate, we also had the arytenoids, cartilages that we were talking about as far as the horse being able to pull them back and get a good breath of air. So I think that's pretty good for that. We'll go ahead and move it on. Other treatments that we do, surgery of course is always an option. Like I said, there's a specialty coming forward for that. And so I'm going to rush along a little bit because we've got some cool cattle to show you as well. But so as far as surgery for a technician, there's always the anesthesia aspect of it. They're handing up and sterilizing all of the tools. There is, as far as treatments go, there's fluids. At A&M we have an ICU that has 2 technicians 24/7 there at all times carrying out treatments on the intensive care patients. We have isolation, so we were talking about those diseases that we need to be careful to pass on. That needs to be within our hospital too. So anything that possibly could be infectious has to go into its own area where there's no cross-contamination. Shockwave therapy, so it's kind of forced sound waves, but it's one of the latest things. They use it in people to break up kidney stones. We use it more for muscle and tendon issues on horses. bandaging and support, and technicians get to do a lot of bandaging. And there really is a technique to it. It's something to not be taken lightly. You can cause harm in bandage bows if you don't do it appropriately.
All these things we learned, and not necessarily just in technician school, but also on-the-job training, which is an invaluable thing to have. If you have someone that's willing to teach you how to do these things in a veterinary setting, by all means, take advantage of it.
Yes. So that last picture up there, so that's my butt up in the air scrubbing on a horse. And actually it's kind of a, I'm not going to say who the other person is because I don't get it, but it's kind of a safety picture. One of two things. One, whenever working around a horse, right, they're fight or flight animals, large animal in general, you want to be able to move. You don't want to be squatted down on the ground so if something scares that horse, it runs over top of you. But then the other thing in that picture, I think we're going to talk about our wounds, but probably my significant wound came not because of the horse, but because of moving in that wet soap. And so I slipped and broke my arm. So, you know, there are things that, again, you learn by the school of hard knocks.
Very much so.
All right. We've gone over a lot of these, but again, on any given day, you know, you can look at your appointment book and it doesn't quite tell the whole story. You know, there's always that charging, client communications, inventory, sterilizing, cleaning, preparing for the next day, the walk-ins that show up that you weren't expecting, emergencies. There's always something to do. The disinfecting, all of those routine things that maybe are less glamorous, but it's part of the role, and it has to be done.
Sad to say, she and I probably clean more at work than we do at home.
I know that's true at my house.
But if you think about it, we have a bunch of animals that aren't necessarily potty trained, and they can't walk outside on their own to go to the bathroom, so you end up cleaning up for them, which I have no issues with. So we're going to talk now about the role of a food animal technician in a large animal hospital. As I said earlier, food animals encompass our cattle, goats, sheep, our camelids, our llamas, alpacas, camels, our deer, and pigs. So we see a little bit of everything. At any given time, we might have one of each one of those species in our barn at the vet school. We also have a tendency to keep patients for long periods of time in that hospital because you think about it, they have an issue. You can't just necessarily send them back out in the field to play with their buddies because they could be hurt. In the picture that you're looking at, she is actually one of our university-owned animals. Her name is Kavina, and she is a Holstein cow that, if you notice, there's a port on the side of her, and she's called a cannulated cow, and what that does is that is a window into her rumen. Most of the animals in the food animal service fall under the category of ruminants, which means they have a compartmentalized stomach. So humans, dogs, cats, and pigs, we're monogastric, but cattle, goats, sheep, alpacas, and deer are ruminants. They have one stomach, but it has 4 separate chambers in it. And what this does, and Sandy's holding one of those ports, what we do is we go in and we make a hole in the side of the cow, and we attach the side of her rumen to her body wall, and we add this port. And with this port, we can open up, we can just pull the center out, which is a window, and we can go in and we can look to see how she's digesting her food. This is good not only in the research aspect of it, but we use her rumen fluid to help other ruminants that might be sick, and we call it transvenation. And one of my other really neat little items here, it's called a McGrath pump. And what we do is, say I take some rumen fluid from Kavina, I have to put it back down into another animal's rumen, and I'm trying to get it to where you guys can see this whole thing. So this is bigger than I am. It has a pump on one end, and this end is a long metal tube, and the reason it's metal is because she can't chew through this. And we slide this down into her mouth, down her esophagus, into her stomach, and we can pump healthy rumen fluid or water, electrolytes, all that type of thing in there. And just so you know, this McGrath pump probably weighs a good 20 pounds. So, as Sandy was saying, you don't necessarily have to be large in stature, but you have to be somewhat physically fit to be able to handle this. So the other things that we do in the large animal and the food animal services is very similar to the equine service, to where I'm responsible for medications that need to go to the patients on a daily basis that we have hospitalized. We also take care of IV catheters. In ruminants, we use their jugular vein just like they do in the horses. We also collect samples for our lab work, and one of the samples that we get from our ruminants that you don't get from the horses or dogs and cats is rumen fluid, which is very important because if their rumen isn't working very well, then they're not going to be able to digest their food. We're going to move on. Okay, one slide's working, the other's not. So what you see here are our chutes. We have hydraulic chutes that we have at the vet school. Cattle don't necessarily walk in and stand still for us like we need them to. They're not generally as well trained as the horses. However, we do get some show cattle in that are very well trained. We have to make them walk into our chutes. We squeeze the little gate around their head. What it does, it just rests on either side of their neck to hold them in place so they can't pull their head backwards. And it kind of gives them a nice little squeeze on their body, which somewhat comforts them. It's a soothing atmosphere in there. We always try to act quiet and calm, and they seem to calm down, and we can do pretty much anything we need to with them once we get them in the chute. We also have, in one of the pictures, in this one, our chutes will tilt 90 degrees, and they always tilt 90 degrees to the right because the rumen sits on the left, and we don't want them laying on their rumen because that is their main digestive compartment. When we put them in these chutes, the floor will drop out and we can work on their feet. You know, horses you can walk up and lift a foot up and hold it for long periods of time to work on. Cattle, not so much. So we put them in these 90-degree chutes and we can work on their feet. If they don't have healthy feet, it's not a healthy cow, because think about it, most of them weigh about a ton. Some of them are a little bit more, so we want to make sure that their feet are well cared for. We do a lot of the same things, such as physical exams, surgery, assist in that. And we also, just care for the patient. Some of these animals are frightened. We stop, sit, and talk with them, just like a small animal would. Some of them you can pet. We have a few in the hospital right now that have been with us for a good 4 or 5 months. They had fractures, and so they stay with us. And they are actually excited to see us every morning because we sit with them, we rub their little heads, scratch behind their ears, just like the small animals, and we spend time with them, letting them know that it's a safe environment. When I was talking about earlier with the McGrath pump and also the port, talking about rumen fluid. Rumen fluid is very important when it comes to our ruminants. And we have a video here that kind of shows you what healthy rumen fluid looks like. These are all microorganisms. I don't know how well you can see it, but if you could look closely at all these little guys, they all have little cilia around their bodies, and they swim around, and they help digest the food. Ruminants eat a lot of grass. They eat weeds. They can eat sticks. And because of these little microbes, it breaks it down into nutrients that you and I would get from our steaks, our potatoes, and that type of thing. You think about it, we eat lettuce, but our bodies can't break it down like a ruminant can. So very important aspect right there in the health of a ruminant. We like rumen fluid, it's kind of fun.
A lot of different kind of critters in there.
There's probably 5 or 6 major things that we're going to look for on a rumen sample, and we get it by sticking a tube either up their nose and down into their rumen, which of course they have to swallow to get it there, or we can use the McGrath pump and aspirate back instead of pumping in, and we look at it to see how healthy the patient is. And we can give them some healthy rumen fluid if their rumen isn't a happy thing that day.
Well, ladies, we only have about 2 minutes left. If anybody that's out there that's one of the interactive sites, if you'd like to open your mic, does anybody have a question for one of these ladies on their job or about being a large animal veterinary technician, you have to open your mic first and then ask the question.
Either we were really good or
there we bored them to tears.
bored them to tears.
Well, we have a couple of questions that were actually submitted ahead of time, and one of them I'd like to know the answer to is, what's either one of your most interesting or most difficult cases that you've had recently? And we have about 1.5 or 2 minutes.
I would say my most interesting recent one would be we had a foal that they brought in that was about 3 months old, and it had been kicked in the head by its mare. His name is Reno, and I can say that because the clients have put it out all over the place. They're very proud of his journey he has made, but he actually had skull and hair fragments in his brain, and with the experts that we have at Texas A&M, we had our neurologist come over and we put him in the MRI and the CT both, saw where the problem was, actually took him to surgery immediately, had the neurologist and our surgeons pull all of the bony fragments out, close it up. He ended up having some seizures after that for about 36 hours. We got him past the seizuring stage, but he is after staying with us for 30 days total, had some very devoted clients, great clients, and he is up and running and doing well.
I think I've seen him on the news, and even I think he has his
Yes.
own Facebook page now.
He does.
So I think they're very proud of
Yes.
how well he did.
They are very
And
proud.
Sheila, do you have something? We have about a minute left. Would you have something you'd like to tell the students about?
We have right now a very sweet little heifer. For those of you that aren't familiar with the terms that we use in cattle, a heifer is a young female cow that's never had a calf. And she actually came in with a leg fracture. Yet again, one of those where you're not quite sure if they're going to make it, but is doing beautifully right now.
Leg.
Oh,
So
leg, sorry.
Yeah.
Hi, we brought a leg. However, this is a horse leg, but close enough. But she fractured her hind leg, and you think about it, she was probably 2 months old when this happened, and she was only 100 pounds at that time. We've had her at the hospital for 4 months now, and she's almost 400 pounds, and she is doing beautifully. I mean, it takes, you think young animals will heal much faster, but when you have that amount of weight on a fracture, it takes a little bit longer. But I have to say, it's really nice to see that we can do that type of thing. We have gone in and surgically put metal plates in her leg to hold the bones together. We've subsequently taken those metal plates out, and we just keep changing her cast, and she's healing beautifully. So the fact that veterinary medicine can now take an animal that will eventually weigh over 2,000 pounds and fix a leg fracture to where they can live a normal, healthy life. She'll never go running around the pasture with her friends, but she can walk normally. She'll be able to reproduce. And, it's nice to see that we no longer have to. Everybody imagines a horse or a cow with a broken leg, it's an automatic death sentence, but it's not anymore. And it's because of working in the university system to where we develop these things, and then out in private practice we can do this now. And it's very rewarding to be able to see this happen. And we care for them too. I mean, it's one of those where they kind of become our pets. They're not just somebody else's. They become ours while they're with us.
Vicariously.
Well, I certainly would like to thank both of you ladies for joining us today. We've come to the end of our video conference, and I know by looking at that list, that's an exhausting day, and we're fortunate that they've allowed you, that you guys have been able to come here and do the video conference. So thank you very much, and I'd like to tell everybody thank you for joining us for our video conference today. Remember that we're the peer program at Texas A&M College of Veterinary Medicine and Biomedical Sciences, and we're funded by the Science and Education Partnership Award and the Emma Barnsley Foundation. Thank you very much for joining us today.
Thank you.